of the morning, which is sickle cell disease in the emergency and in the inpatient department. We have 3 individuals who will be our panelists this morning. And I believe Dr. Jennifer Bryan will start by introducing the panelists. Thank you.
Thank you, Lonray. Excellent points to consider in reviewing the results of that project. Thank you. Our very first speaker to speak about her experiences as an advocate for sickle cell is Chavake Kamisha Hemmings. Ms. Hemmings is a patient advocate who is dedicated to serving the sickle cell community. She's raising her voice through SCAGO's Patients Advisory and Advocacy Council to ensure equitable care for sickle cell disease patients, not only in Ontario, but globally. And I'm going to share some beautiful slides here. And Kamisha, would you like to go ahead? Thank you.
Good morning, everyone. My name is Chavake Kamisha. I first off would like to thank Ms. Solanry and everyone at SCAGO for this opportunity. I also want to thank Dr. Jennifer Bryan as well. So we'll first start off by looking at the patient experience. Next slide, please. So as an individual with sickle cell, oftentimes going to the emergency department is a last resort. I personally have done everything at home. I've taken my pain medication, I've drinking more fluids, I've used a heating pad, hot compress, muscle rub, and going to the emergency department is literally the last resort because everything else has not worked. And oftentimes, as Ms. Lanny has mentioned, we're being stigmatized. We're getting doctors and nurses who judge us, that don't understand, that they're not kind. They view us as individuals that are there for drugs, that our pain isn't as serious as we say it is. And oftentimes, the simple steps of giving us IV fluids and pain medication and monitoring our symptoms to see if we're getting better or worse, that's not happening. Sometimes we're left waiting for hours at a time just to get the basic care that other groups and individuals of people get taken for granted. The simple action of giving us IV fluids, giving us pain medication, monitoring us. Is our pain, being lesser, or is it getting better? If not, repeat, give us more or less pain medication and continuing. That's not being followed through. Next slide, please. So my most recent hospitalization was at Brampton Civic, also known as McMaster. And this was at the height of the COVID pandemic. And I have to be honest, I was a bit surprised with this particular experience. I'm not sure if it was because COVID was rampant and everyone was more heightened and had more alertness, but this particular experience it was fast, it was efficient, it was a bias-free environment. When I went to the hospital and I explained that I'm here for a sickle cell crisis, my pain was taken seriously. I was instantly given IV fluids, as I mentioned. I was instantly given pain medication. The situation was monitored. And I was like, I'm surprised. Like, normally this rarely happens when we're dealing with individuals with sickle cell. And this should not be the case. I should not be surprised that I am getting good quality care. This should be something that I should be used to. This should be the standard, the norm across all healthcare systems in Toronto, Ontario, wherever. But the fact that not being used or getting, I should say, fast, efficient, having a bias-free environment is something that was new to me and I was surprised with is something that we as a system, as a community, need to work better on. Next slide, please. So oftentimes we look at the negative stigma that comes with emergency departments. We have staff that really don't know anything about sickle cell. You might have a doctor and nurse ask you, Ms. Hemmings, how long have you had sickle cell? Or did you just get diagnosed? Or they have you, as Ms. Lanny said, look at you as a drug seeker, that you're just there for the pain medications, or you're waiting for a long period of time. And this should not be the norm. This should not be what we're used to. But at the same time, we also have to look at doctors' offices as well. For me, I currently have a really great hematologist, but beforehand, it was a trial and error situation where I had staff, I had doctors, nurses that didn't know anything about sickle cell. They chose not to listen to me and what I wanted. They chose to disregard the fact that I've been living in this body for 27 years and I know more about it than anybody else. They chose the fact not to understand me and not to listen to what I wanted. And I feel like this is something that needs to be worked on, where it doesn't matter if it's an emergency room doctor or a family practice physician, that everyone is knowledge educated, knows what sickle cell is, takes the time to listen and understand what their patient needs so that we can have the best possible outcome ever. So this concludes the end of my presentation. I just want to thank you guys so much for your time and listening to me. Hope you find this session informative and educational and that you learned something. Thank you so much and have a good day.
Thank you. So incredibly powerful perspective. Kamisha, I just wanted to comment on one of the things that you said about I should not be surprised at getting good quality care. And I think that really says it all right there. Ms. Lanray, I'm going to let you go ahead and introduce our next speaker, if you would, please.
Thank you, Dr. Bryan, and thank you, Commissioner, for that presentation. Well said. Our next speaker is Ms. Janet Jackson. She's a proud mother of 3, and her youngest child has sickle cell disease. She has been inspired by individuals living with sickle cell disease, families, and advocates that she's surrounded with. And Janet is currently contributing her part as a member of the Patient Advisory and Advocacy Council of the Sickle Cell Awareness Group of Ontario. Ms. Janet Jackson, welcome.
Good morning, all and fellow panelists. It is sincerely an honor to be able to speak in front of every single person here. And thank you for your time and interest in wanting to know more about sickle cell disease. My name is Jane, or Janet, and I have 3 children. The baby of the house, who will be 4 in December, is Isabella, and she lives with sickle cell disease. I remember when the doctors told us that they were going to be doing additional testing because her newborn screen had come out positive for the sickle cell trait. We were asked to give her antibiotics from birth, which I did not because I was certain that she simply had the trait like her dad and I, and not the full-blown disease. And then the results came out and the doctors confirmed our worst fears. My husband had just lost his favorite aunt to the same disease. We had lost a dear friend a few years back. This was serious and nothing we were prepared or equipped for. Although it has been a challenging diagnosis to accept, we have found the pediatric support and care excellent in our personal experience. We live in Ottawa, and Bella has been hospitalized numerous times for infections, pneumonia, and recently a pain crisis. Upon presenting to emergency, she is immediately put into an examination room and given any necessary medication. When she is hospitalized, she is well monitored, and the most important is that the doctors are keeping us up to date on every single test they have run, what the results are. Chio has been amazing. So far, so good. But fast forward to when she turns 18, which I can't wait. And yes, I know to cherish this time, but her peers face the likely risk of running into service providers not well-versed in sickle cell disease, which has led to, as you heard from Ms. Kamisha, stigmatization. Assuming that this 18-year-old has a history with narcotics, they are seen as drug-seeking. Well, to be honest, when this 18-year-old's chemical makeup has been introduced to morphine from the tender age of 3, what do we expect to happen? Sickle cell pain is unbearable, and this patient's pain threshold is high. As Kamisha said, the last resort is the hospital. The standard of care drops significantly when they transition from pediatric care into the adult system. There are studies, as Ms. Lanre said before, that have identified hospitals across patients, which patients and families have picked as needing improvements in their standard of administering care to individuals with sickle cell disease. When a baby tells you they are in pain, it is easy to believe them, but that baby eventually grows up and things turn around. I don't even want to imagine how they begin to manage that. This year, SCAGO, along with the sickle cell community, celebrated successfully advocating and introducing Bill 255 into legislation, which is the Sickle Cell Disease Awareness Day and Thalassemia Awareness Day Act. It recognizes June 19th as Sickle Cell Awareness Day and May 8th as Thalassemia Awareness Day. And we are all asking you to please mark these dates and celebrate with us in solidarity. So why am I really here? So, well, first off, everyone here is a big deal. And second of all, everyone here is a big deal. Every single person here is important. Why? Because you are all playing a vital role in ensuring that one of the best healthcare systems in the world continues to be equitable. We have an amazing healthcare system, but as with the world, we must continue to evolve it. And that is why I am here to speak on behalf of my daughter and all Ontarians living with sickle cell disease. I don't want my daughter growing up and having the same negative experiences that Ms. Kamisha has unfortunately grown up having. Then what would be the point of all of this hard work that we are doing? So thank you so much for just being here. And we really look forward to seeing this clinical handbook being mandated to across all hospitals in Ontario. That might be a first start, because then that sets the standard. And with standard comes accountability. Thank you very much. And thank you all for working towards an equitable system, healthcare system for all.
Thank you so much, Janet. I really liked how you emphasize the importance of every single person in this process. And you've got us all marking our calendars for sure. Thank you. All right. If there are any questions for Janet or for Kavake, Kamisha, please do go ahead and put them in the chat for our Q&A. Next, I would like to introduce our speaker, Gabriel Badejo. Gabriel is a Toronto-based Afro-Canadian producer and director. That you may recognize him from some of the incredible work that he's been doing over the years. He lives with type SS, sickle cell disease. He's committed to increasing research awareness and refining global healthcare practices. Gabriel.
Thanks, Dr. Brian. Thank you, Larry, SCAGO, and everybody viewing and participating in this. This is really important work that's being done, and evolving the healthcare system in Canada is important, like Janet had mentioned. I just wanted to touch on, so I've been working on a project recently that has led me to do a bit of some self-reflection and self-work and stuff. And in doing going through this process, I realized that I was like, why is going to the emergency or the hospital when I have a crisis such a big deal for me? Because I really don't like doing it at all. Like it's like the last on top of last on top of last resort for me. I will do like a lot of things to try and convince myself that I don't need to go to the hospital. And I've realized that it's like there is a lot of trauma from going to the ER and being a patient. And I feel that when you're going to the hospital and you're in a crisis, then when I'm in a level 1,000 crisis on the scale of 1 to 10, and you're going to get help, you're at your lowest, most vulnerable moment. And in those moments when you have the courage and energy to go seek help, and you are being shut down in a way where you feel that people are not taking what you're saying seriously, or you're not believed, or they're mislabeling you, or they just have there's a lack of attention there. Like those moments hit different when you're in a very vulnerable state, which is what it is when someone is having a sickle cell crisis. Like to be like pretty blunt, like it feels like you're dying, and to not get care in those moments is like very, very hard. And you start to like question, like, why are people treating me like this? And I'd like to share a story that happened in 2020. So in the midst of the pandemic, I had a sickle cell crisis. And I got this crisis in my arm and my shoulder. Like my whole right arm was in crisis. And I normally don't get crisis in that area. And if I do, it's usually manageable. I think I said that wrong, but it's okay. And so I usually could manage that by myself with the pain meds and, hydration and stuff I can do at home. But this crisis specifically, like my arm was completely like not functioning. I couldn't bear the pain. So I went to the hospital, and on top of that, this was in August, so things had just started to open up in Ontario, and I was scared to go to the hospital, also because of COVID. Like I was just, wary of COVID, and being someone who's at risk, I was kind of like reluctant to go. But anyways, my friends convinced me to go, so I went, and like it was like I didn't have like a crisis. Like I felt that I wasn't getting adequate treatment or pain medicine or whatever, and I felt I was being labeled, and like they were prescribing pain meds that I literally have I have more like stronger in pill form in my pocket, like going there, so I was there for I believe 2 or 3 days, and like nothing was changing. And at this time also I was working, so I didn't really want to leave my team hanging, producing a pretty big job. And so I just left, I was just like, you know what, like I'll just manage this on my own. Like if I stay here, I'm just not gonna feel good about what's happening. So I left, and I decided to manage it at home. So I went to work every day with my arm that I couldn't even lift it past past halfway mark. And I had that pain for a month, and it was cool that I had like friends and people I was working with that were like supportive. We do like morning stretches to help me like stretch it out so I have more mobility, and I always had my pain meds with me. But a month later, that pain like came back and in double. So I had to go back to the hospital. So I went back to the hospital, and my pain was like extremely bad. And I was labeled as a drug seeker. So they were trying to avoid giving me like adequate pain medicine, and in the emergency department. So after a day, like a day and a half, I was admitted to the inpatient unit. And I guess because of whatever was happening in the emergency now followed me into the inpatient, and they were literally trying to avoid giving me painkillers that they thought I was addicted to or seeking. So they were trying to give me low doses of pain medicine that I've never even taken before in my life. And I kept trying to advocate for myself, but like it just wasn't, I just wasn't being heard. And this went on for literally 5 days. And with getting low doses of pain meds that I've never taken before, make me feel weird. Like I know what, like for the most part, I know what works for me. And I was advocating for myself. I felt I wasn't being heard. And ultimately, on the 6th day during the rounds, a doctor, on the 6th day, a doctor in the rounds, mid-rounds, recognized me from time I've been a patient before. And he was like, oh yeah, like we can give him like a higher dose of meds, like he's been here before, like I know him or whatever, it's okay. And after that, they decided to, they as a team collectively decided to listen to what I've been trying to recommend for myself. And they did. And I was out of the hospital in 3 days. So it took them 5 days, and I was suffering in pain for 5 days, and nothing was working. And then it took a doctor who recognized me to help advocate for me, and they gave me sufficient care, and I was out of the hospital and feeling good in 3 days. And when I got home, or I got picked up when I was discharged, I got home. I was in the parking lot. My friend had picked me up, and I got a call from the hospital, and they said that the x-rays they just took of my shoulders revealed that I had AVN. And I've developed AVN in my shoulder, and a bit in my collarbone. And and I know these things happen. I know these things, like with sickle cell, you develop like other issues or whatever. But my thing that struck me was, for 5 days, nobody listened to me, and I felt that nobody believed my pain. And at the end of it, they have to give me a call over the phone telling me I have AVN, which is a serious condition. So yeah, that's kind of a story I wanted to share with everybody. And again, I'm glad that we're making efforts and conscious steps forward to better the care for sickle cell patients. Thank you.
Thank you so much, Gabriel. I'd like to invite you to keep your video on, if you would. Janet, Kamisha, if you can turn your videos on as well. We have a few minutes for a Q&A session before we move into the hospital sections. I just wanted to speak to, one of the things that we've heard from each of you is talking about this idea of being pain seeking, or sorry, drug seeking when you go to the hospital. Even though we should all know that the rates of opioid use disorder are actually lower in people who have sickle cell than in the general population, right? So a lot of misinformation to dispel there. We have a couple of questions in the Q&A, and one in particular was addressed to Gabriel, but I think could go to each of you. Is there anything that you've been seeing in terms of improvements to care? The theme for this weekend is to talk about what hospitals are trying to do to address some of the barriers. So have you seen anything yet that's been getting better? And maybe we can start off with you, Kamisha.
So yeah, I think when it comes to improving quality care, most hospitals are working to get better. I believe like the clinical handbook should be in all emergency departments where emergency staff have access to view it and know the correct treatments that need to be put in place when dealing with a sickle cell patient.
Excellent. And we're going to be hearing even more about that clinical handbook from Dr. Vahasek in a later session. Janet, anything from your perspective, any signs of light here for things improving?
Absolutely. The fact that more and more hospitals across Ontario are starting to form patient groups, working groups, where emergency healthcare professionals and patients are sitting together and discussing their care, so the patients are able to speak directly to the individuals that are in charge of their care. I think that's one step towards, and that these conversations we should keep having these sort of conversations, because if we're not involved in the picture, if we're not being heard, how will you know what our needs are, what their needs are, right? So
exactly. Thank you. And Gabriel, any last point to make here?
So I actually feel that I don't think that there's been much change across the hospitals except for UHN. UHN is that's UHN. If I go to a UHN hospital, honestly, that's probably the only time where I feel like I can let my guard down going into the hospital and throughout throughout my care and my stay there. With other hospitals, and like sometimes it's hard for me to get down to UHN because I live in North York. I'm uptown, so making that trip downtown, especially if it's like rush hour or something, is difficult. But I think it's more of like it just depends on who is seeing you at the time in the ER or in the inpatient unit. It kind of depends on what their experience level is with sickle cell. So if they don't have experience or great knowledge about sickle cell treatment, then the care isn't going to be that good. But if the person does, then it will be good. But I find that in hospitals outside of UHN, it's not that good, to be honest. And like I've heard stories from other warriors with sickle cell this year of like terrible things that that shouldn't be happening with all what we know about the treatment with sickle cell, you know, like this year. So it's like these kind of things shouldn't be happening still, especially if there is a hospital in our, you know, in our grasp that is kind of like leading the way, I feel. So yeah.
Excellent. So really going back to what Kamisha was saying right at the beginning, right? How a good visit it shouldn't be the exception. That should be the rule, right? And I think that's really the goal for this entire summit, is to help us move towards having a good visit every single time you go to the hospital, no matter who is seeing you, no matter what the hospital is that you're visiting. Thank you for that. I'm going to hand things back over to Ms. Lannery to introduce our next session.
Thank you, Dr. Bryan. Before I introduce the next session, I wanted to just look at one quick question we still have in the Q&A box, and that will be the last one. So the question is, the individual mentioned that they've been reflecting on humility lately, and they wonder if the speakers feel the sickle cell knowledge of care providers is more important, or whether listening and recognizing lived experience is more important, or are they equal? I will ask Gabriel to quickly, provide his perspective on this. So do you think that sickle cell knowledge by care providers is more important than listening and recognizing lived experience? Which is more important, or do you think they are equal? Quickly, Gabriel.
Yeah, I think they're equal. Like one, if you don't know how to treat sickle cell, like, or what to do, like, as we know with the illness, like, things can change very quickly. So in order to like be on top of that, to change things quickly, then or to get on top of the crisis or whatever's happening quickly is very important. So you need knowledge for that, but also it's you need to listen to it's not just sickle cell patients, every patient we should be listening to. So it's both.
Thank you. And with that, we'll conclude the patient panelist session, and we move on to the group 1 hospital sessions. Thank you again, Kamisha, Janet, and Gabriel. Thank you.